welcome back. As we promised, we are going to discuss the first annual forum of the General Authority for Universal Health Insurance, which took place on Sunday, and with the participation of His Excellency Prime Minister Dr. Mustafa Madbouli and Minister of Health Dr. Khalid Abdel Ghaffar, in addition to a number of top executives and other representatives from international institutions like the World Bank, for example. The important gathering really discussed a number of vital topics related to our health system in general and efforts exerted by the state to introduce a better health service to the citizens. To shed more light on the issue, we are very much delighted to have with us via phone Dr. Islam Anan, Professor of Health Economics. Thank you very much for being with us, sir, and a very good morning.
Good morning. Always a pleasure to be on the show.
Thank you, sir. Before going into details, tell me about the idea of having this forum. I mean, the most important topics which were discussed with the participants, and what has been on top of the agenda.
Okay, so to start, we need to shed light on the Universal Health Insurance Authority, which was actually established in 2018. The main driver of having a Universal Health Insurance Authority is we had a situation that the expenditure of our healthcare was 60% driven from out-of-pocket, from Egyptians' pocket, and only 40% from governmental sector. And the vision of Egypt is to change that. In order to reach 2030 vision, we need to have an 80% to 90% of public insurance, and only 10% is coming from private sector out-of-pocket. And in order to do that, it's very important to have an authority which is not only giving insurance, but making sure that we have equity in terms of healthcare coverage, and we do have a solidarity in terms of coverage as well. Mm-hmm. So this first annual forum was not only an event, it reflects the strong commitment of Egypt to strengthen the healthcare system, to make sure that we do have the infrastructure, we do have enough technological infrastructure, human resources, and the will to reach the 2030 vision. The strategic collaboration between the public sector and the private sector was actually the main highlight of the first forum, because in order to reach our vision, we need the partnership to be there. The private sector is actually increasing hospital beds. They are actually good collaborators to the healthcare system, and they can be the service provider among the Egyptian Health Authority, which is the main service provider of the UHIA.
Since you mentioned that, sir, if you please, I'd like to interrupt here just to speak in numbers. Growing role of the private sector, these were the statements of His Excellency the Prime Minister, noting that the share of the private hospital beds increased from 21% in 2011 to 29.3% in 2022. The private hospitals now account for 63.3% of the total, up from 59% in 2011. What you're saying, sir, is that we are not satisfied with this share, and we do have plans to reach 80% before 2030. And this is what I understood. Please correct me if I'm wrong.
So the 80% of 2030 is the 80% of the Egyptian citizens covered by a public insurance. Okay. And hence the numbers you mentioned and the increase in beds in the private sector, they can be huge and significant collaborators to the public sector, so they can serve as service providers to the Egyptian citizens, but under the public insurance. So it means that the public insurance will be paying the private hospitals as if it's a private insurance company, so they can be actually go to private hospitals, get their treatment there, but it is reimbursed and it is procured from the public sector itself. So having said that, and the numbers you mentioned is very important, because it demonstrates that the private sector is main player in Egypt's healthcare system and in the service providing facilities. So we need the private-public partnership. And this will ensure actually another important point, which was actually highlighted yesterday, which is financial sustainability. Financial sustainability is very important, and there is no single country that can actually maintain on its own without the private sector the financial sustainability of the reimbursement of the medical insurance. We need a lot to make sure that we are expanding the healthcare coverage across Egypt horizontally and vertically in terms of disease areas, in terms of government rates. We need to make sure that the strategies that we have are actually incorporating the private sector inside it. And another important point is to encourage the private sector in enhancing the investment in the healthcare. Enhancing investment, and hence the figures you mentioned, and the increase like 20% in number of beds. And in the next 5 years, we are expecting a lot of private entities and private hospitals to open as well in Egypt in terms of service providing, but working with the public sector. So they are providing their services to the Egyptian people for free and get paid from the government. Another point which will be benefiting from the private sector is the digital transformation. We do have the plan of the public sector digital transformation, and we do have the private sector as well. And we can benefit from both experience to have an integrated digital transformation system that will aid to the vision of 2030.
And also, Prime Minister Dr. Madbouli said that after the success of the first phase of the medical insurance system, which was implemented in several governorates, the second phase is going to take place. And he named some governorates, I think Damietta, Matruh, North Sinai, and Kafr Sheikh, as far as I remember. And I think we learned some lessons from the first phase. I mean, we are modifying our way of implementing the health insurance system, particularly in the second phase, after what we have been through in the first phase. If this is true, what are the most important things which are going to be modified or on the ground are going to be avoided to make sure that the second phase is going to be even more successful?
That's a very important question. So the first phase, what we call the pilot phase, is to make sure that we understand the infrastructure. We understand, most importantly, the people inside the governorate, their needs, their satisfaction levels, and to make sure that the lessons learned are actually taken forward in the second phase. A lot of lessons are taken from the pilot phase, which the first one is how to make sure that we do have a unified treatment protocols, that the people coming from the old insurance system, they are not deviating from their treatment plan to the new one. Hence, the transformation in terms of automation and digital records inside the hospitals aided much in that transformation, making sure that each citizen got an electronic record that we can track their history, they can track out their treatment, so they're not going to be dropping out of the system or dropping out of their treatment. And this is very important. The new health insurance system, it acts like a catalyst to the insurance and the citizens between them. Having a better dialogue. So, for example, one of the lessons learned is having a call center which was not there in the old system. So the citizen can just call the call center, make sure that he got his appointment, making sure that we are tracking the TAT. And the TAT, one of the main lessons learned, TAT, it's an abbreviation of the turnaround time. The turnaround time of the patient once entering the hospital to receiving the service itself. Tracking that was not a habit in the old healthcare system in Egypt, but now they are tracking by minute. So how to make sure that we do have a target from the pilot phase to the second phase, that patients are not spending too much in waiting areas, are not spending much in diagnostics till they get diagnosed, and so on. Another important point is to have the patient's feedback or the citizen's feedback.
Sure.
So having a system that ensuring that we do have the satisfaction level, their complaints, and having a hotline so they can actually say, I spend too much time there, I spend too much time here, I would like to change even the hospital, I would like to have my operation in. So having this call center for satisfaction is another lesson which will be applied massively in the second phase.
And to use our potentials, Dr. Islam. I mean, sometimes I feel when I see or I visit some of, particularly the university hospitals scattered all over Egypt and affiliated to our veteran universities with great experience in all health domains, in all health sectors, I feel that sometimes, unfortunately, we did not know how to make the utmost benefit from such educational institutions where people or where doctors with very great experience can help a lot. In addition to, as you mentioned, the word sustainability more than once during your valuable input. Of course, I feel that here I should include the term CSR, if you permit me to say so, or to include this term into this field or the gathering of yesterday.
So the responsibility of the corporate is very important. It's very important, the corporate social responsibility, because it highlights as well, again, the partnership between the public sector
and private
and
sector.
the private sector, as well as the CSR, as well as the non-governmental organizations, as well as all the associations that work actually of profit. And most countries are doing that. We don't need to work in silos. We need to work in integration. And that's one of, again, of the lessons learned in the pilot.
No more
So
separate islands. Yes, amen to that. And
exactly.
yeah. Sir, also another important topic which I really want to focus on and to make sure that it's included. I mean, when it comes to health insurance, I want also to speak about the, let us say, diseases like autism, diseases like generic diseases, things which I think should be taken into consideration more than before, if you permit me to say so. Because in addition to the chronic diseases we know, there are things, or there are some diseases which unfortunately were not met with the suitable way of treatment or even management before. If you want to elaborate on that.
So if we talk about mental health or psychological health as well, it is very important to highlight that the diseases covered by the new health insurance system is a bit different from the old one. There is more focus in terms of mental health. There is more focus in terms of making sure that the health and wellness is there. Because if you look at Egypt's vision in 2030 for health, it's focusing on health and wellness, not only focusing on treating patients having diseases. And this is very important, which is and protective if we are talking about pre-diseases. And hence, the presidential initiative in collaboration with the insurance system is very important, because the launch of the presidential initiative for mental health, for example, is to have a horizontal umbrella for all the insurance system, for all governorates, so that the new health insurance system, the old health insurance system, can actually work under that umbrella and make sure that by 2030 it is incorporated inside the system, so people with mental health can be treated in a different way.
Mental health and hereditary diseases.
And for autism as well, because you mentioned autism, there is a sub-campaign only for autism and mainly dedicated to the caregivers, the parents, how to educate them about dealing with their children, where are the schools that they can direct them to, how can they actually enhance their skills, how to, what we can say.
And the early diagnosis in the first place, Dr. Islam, because unfortunately, and I think until the moment, autism is not diagnosed early. This is another issue, which I hope it's gonna be managed well.
Early or probably, yes, that's actually correct. And this is actually an education going to the primary care physicians. Because when they see a child and their first encounter with children and pediatricians as well, they need to know the signal. And it's a very simple scoring system that physicians, primary care physicians, nurses, they can make to infants, to children, to make sure that they are free from any shadow of autism. And if they do have any shadow of autism, how can we make sure that we diagnose it early, as you mentioned, and then put it into action in terms of education.
On the right track.
Yes, and correct that with their schools and so on.
Yeah. One final question, sir. One of the participants was Stefan Gimbert, I hope I'm pronouncing his name right, the World Bank's regional director, who really praised Egypt's progress in reducing birth and mortality rates while increasing life expectancy, and also he hailed the Egyptian achievement of eradicating virus C and to be rewarded by the World Health Organization for this achievement. Tell me, sir, about the fruitful coordination between Egypt and other, let's say, international economic institutions like the World Bank, as he affirmed that the World Bank is really pride in partner with Egypt in such initiatives. Tell me about this, sir.
It goes way back. So if we look at the collaboration between the World Bank and the Egyptian Ministry of Health, for example, you will find that they collaborated in the hepatitis C eradication plan. The first one in 2015 and the second one in 2018, which is 100 million healthy lives.
Yeah.
And the collaboration is very important because we are not just talking about financial funds. We are talking about knowledge transfer. We are talking about technology.
Yeah.
And we are talking as well for international recognition, because each step we are actually going through in the eradication of hepatitis C, for example, it is recognized globally by an international body. Having an IO, international organization, on board makes sure that our steps are actually systematic and making sure it follows a specific scheme which is agreed globally. Same like the WHO, the World Health Organization, which is going hand in hand in the strategy and the tactics we are doing to make sure that we are taking the right scheme and we report the right scheme as well. Another point that you highlighted and very important is not only about hepatitis C, it's also about how can we make sure that we do have healthy individuals in terms of birth rate, in terms of mortality rate. We are focusing on the quality of life and the quantity of life. Quality of life, it means that they are living in good health and wellness, and quantity of life, that we do have better age expectancy. Usually, 3 years ago, we have 2.5 million new births every year, and that was actually putting a burden on the hospitals, on the economics, on the parents. So we're not talking about that human resources is actually bad, having more children is actually bad. We are talking about having the sufficient to the economy birth rate. Having the sufficient economy birth rate, and we are a young population, will make sure that we can sustain education, we can sustain having healthy lives, we can sustain.
We guarantee a better future for the coming generation. This is exactly what we are saying, to invest in the health of the Egyptian citizen, meaning that we do invest in the new generations a better life and better future. Dr. Islam, I always enjoy our discussion. Sir, thank you very much for your input, and I'm going to leave you with a promise to have you live here in our studio to speak in more details about this important gathering and about its outcomes. Well, sir, thank you very much. Right after the short break, we are going to return back with more. Stay tuned.